Welcome back. Now let's get into some mining news now. And the increase in the number of COVID-19 infections has indeed sparked criticism. And the sector has mandated by law to comply with the Department of Mineral Resources guidelines to limit the spread of the virus in the mines. Now, mining operations were allowed to resume at what was reduced capacity then when the lockdown regulations were eased. Let's chat about this though and a whole lot more. Dr. Thuthula Balfour from the Minerals Council South Africa does join us as well then via Zoom. Dr. Balfour, this has been a sector that has been blamed by the likes of Uncool for perhaps reckless endangerment when it comes to some of their workers. Would you agree to that in some way? Would you agree that perhaps regulation hasn't been fully taken on when it comes to the mining sector, or is that completely false?
Good afternoon, Arabide, and afternoon to the listeners. We have stuck very much to the regulations. The mining industry is very highly regulated. We are also very used to, abiding by regulations. And again, the Minerals Resources Department is very good at impacting our mines. So we don't have a problem regarding application of the guidelines that have been issued by the department.
Dr. Balfour, then where do the allegations then from the likes of particularly Uncool then come from, saying they actually want mines closed then until we actually get things right? They believe that there've been a spike in the number of infections with regards to mine workers getting COVID-19. Where would allegations like that then stem from? Have you looked into those? Have you had conversations with Uncool?
We actually keep daily records of the infections in the industry. All the mines do. The concern will come when we had a number of outbreaks. With any epidemic, you will find that there will be outbreaks. So in some of the mines, there were outbreaks, and I think that's where then the concern started. But what we have seen now over time is that everything is settling. We are getting a steady stream of the number of cases that are reported, in the mines, and it's in line with what is happening in the country, where generally there is an increase, as we had expected, in the number of COVID cases, because it's a virus that is far more active in winter, and we are now getting into winter, and therefore the number of cases is rising. It is not rising very rapidly. Therefore, we are not particularly concerned at the moment.
Dr. Balfour, then taking this into account, taking the spike, as you said, in the number of cases, as you say, which is in relation to the country as well, then in a time like this, what is the mining sector doing, perhaps in addition to try and limit the number of cases that are then felt or reported within the mining sector?
So the mining industry is a microcosm of society. And so when I say what should we be doing in the mining industry, it's similar to what we should be doing in the country as a whole. Right now, we all need to be taking precautionary measures. The president, the minister have been at pains to inform all of us what we should be doing regarding to the prevention of the spread of the disease. In the mining sector, of course, we do risk assessment. The type of work that is done, and we then make adjustments accordingly. But as we go into the epidemic now, the full-blown epidemic in the country, it's all about sticking to the tried and tested ways in which, we all are supposed to be preventing the epidemic. We are also moving on then to look at the issue of vulnerable people, because that is how we will weather the epidemic without maximum or a lot of mortality. The number of people who will die is because we have people that are vulnerable, and therefore we are now ensuring that vulnerable people are not exposed. And so when the mine workers are being, coming back to work, as we are now going to be starting to work at 100%, it's not everyone who will be called. For their own safety, so that, they are not unnecessarily exposed to a very virulent virus. So those are the things we now need to be concentrating on, and also we need to be concentrating on working together.
Sure. Dr. Balfour, you'd appreciate, however, that
we need to be working together.
Yeah. Dr. Balfour, you'd appreciate, however, that the mining industry is not necessarily a complete reflection of just normal South Africa, because when they go down the shaft, when they go into those underground mines, I've set foot in a few of those, and you can tell that the air is thick, and you can certainly be able to perhaps transmit something like COVID-19 extremely easily, perhaps a little more easier than you would even under normal circumstances above ground, and it makes it the hotbed of this scenario. So do you not think that perhaps even additional measures, not just social distancing and masks, but additional measures do certainly need to be taken into precaution here, because it is a difficult scenario down there?
You are very right, which is why then each mine actually has a risk assessment, and over past mine, for instance, where people are working, there is different from if you work in an environment where there is artificial ventilation. So we do therefore need to look at things like improving the ventilation so that the airflow is far more. And again, the way in which people work is adjusted. For instance, right now, when people are going down, they no longer go down as the 100% if there were 60 in a cage. They are no longer like that now. Those are reduced in terms of numbers. People face in a certain direction. Let's say they all face forward and don't look at each other. And you then have the additional things such as the PPE, which is appropriate and a higher level in mining than the normal person, let's say, who can do with a cloth mask. In most industries, people are able to work with a cloth mask. But in mining, we have to provide them with extra efficient masks or even face shields if those are more comfortable. So all of those are taken into account depending on the circumstances of that mine.
All right. Well, I do not envy your job, Dr. Balfour. It certainly is a tough one and an extremely difficult one in a sector that certainly needs the revival, that needs the growth and needs the production. Dr. Thuthula Balfour there is the head of health at the Minerals Council for South Africa. Thank you so much for your time this afternoon here on Point.